Welcome to our podcast, The Better You Are, The Better You Are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us. The better you are, the better you are.
Welcome back. And thank you so much for supporting our program. We hope that it's encouraging and uplifting for you. Today, we are going to talk about health, nutrition, fitness, and exercise. Our guest today is uniquely qualified to talk about these topics. She is Alta Skelton, the Director of Fully Armored Family Health and Fitness in Carmel, Indiana. Alta is a board-certified family nurse practitioner with master's degrees and advanced certifications in integrative medicine and advanced cardiology. Her faith, her fascination with the knowledge of the human body, and her love for people are what motivate her to share that knowledge with others in order to help them improve their health mentally, physically, and spiritually. We're very excited to have her with us today, and we hope this is encouraging and helpful for you. So let's get started. I'd just like to thank everybody for tuning in today. We thank you for being a part of this podcast. We hope that it blesses you and that you gain some knowledge, expertise, or something that helps you with your life in these efforts. Today, we are going to talk about hypertension, which is high blood pressure, and diabetes, two very common conditions in our society. And we're blessed to have Alta Skelton here with us. We're going to talk about hypertension, diabetes, and lifestyle changes, but Alta is a nurse practitioner. And while some people have heard of nurses, they've heard of doctors, maybe they haven't heard of nurse practitioner, maybe they don't know what that is or what it entails to do that. Could you tell us a little bit about what a nurse practitioner is, maybe a little bit of your background, how you got there? Maybe there are women, men, other people out there who want to be a nurse practitioner, and maybe some advice you'd give to them for that.
Thank you. And thank you so much for allowing me to participate in this podcast. It's a passion of mine to keep people healthy and prevent things like diabetes and hypertension. So when I was an RN, a registered nurse, and still a registered nurse, but I worked in the intensive care unit, and I wanted to do something further to help prevent people to arriving into that intensive care unit. My 2-patient weight combined that day was over 1,000 pounds. And I thought, this is not good. So I went to one of the attending physicians. I said, we have got to do something about prevention. And he said, Alta, no one does anything with prevention, and insurance companies don't pay for that. So that's when I pursued a nurse practitioner role. So with a nurse practitioner, you start off as a registered nurse, a 4-year degree, and then go on to graduate studies, which is a 2 years master's degree. And now a doctorate degree in nursing is required as well, will be required in the state of Indiana. So it's more than just a registered nurse. I can prescribe medication. I can prescribe treatments. I can prescribe modalities, for instance, cardiac recovery and nursing home prescriptions, any kind of prescription medication if I want to, or lifestyle modifications. Also, I own a private practice in Carmel, Indiana, so that's another thing that nurse practitioners can do. So we have prescriptive authority. We do have to have, as of now, a physician that we call a collaborative physician. So that physician signs off on prescriptions that we write. They need to review 5% of our charts on a weekly basis. But otherwise, we do everything that a physician does except extensive surgery. So we do minor procedures such as mole removal, cuts, scrapes, tears, sutures, but we don't do major surgery. So that's the difference between a registered nurse who does not have the extended privileges.
And you're happy that you made that decision to go on, even though it's a little bit of extra time, 2 years of study, and now a little bit more, but it's well worth the effort of putting in that little bit of extra effort so that you can do what you feel a passion to do.
Absolutely. Well worth it. And as a matter of fact, sometimes nurse practitioners have more flexibility with their time and able to spend more time with patients. I slot out 30 minutes minimum for our patients, 45 minutes for a physical.
Nice. Nice.
Instead of having to see patients every 10 to 15 minutes that is often required. So you get to really know the patient, build that relationship, and hear what they're trying to tell you.
And I know that, we're both in medicine, and I know that's very important for patients, particularly, quite frankly, for people of color, to feel like they're heard and understood and have a connection with and a relationship with their care providers, whoever they may be, to get the best care for them and their families. So that's exciting. Well, let's talk a little bit about hypertension and diabetes, and more importantly, lifestyles that can, and eating and activity that can help prevent it, which is a passion of yours. And I always say knowledge is power. I have a friend who says food is medicine. You combine those two together, and that's what we're here about today. So maybe you could talk a little bit about high blood pressure, what's a normal blood pressure, what's a concern for high blood pressure, and then we can talk a little bit of why do we want to control blood pressures?
Absolutely. So as of 2017, the guidelines changed for hypertension. And what is hypertension? What qualifies your blood pressure as being high? So it used to be anything over 140/90 was considered high blood pressure. Now the recommendation is to start treating blood pressure if the blood pressure is over 130/80. So how many times do we see patients come in and their blood pressure is well over that? And also they come in sometimes saying, my blood pressure is just high here. Is it usually at home? It looks good, but today it's really high. And that's because I'm in the provider's office and I'm nervous. So one of the main things that is so important is what we call a 24-hour blood pressure monitor. And this is what we do when I find a patient that comes in and their blood pressure is higher than I want it to be. It's the newer standard too, to do that 24-hour blood pressure. So that way you can tease out whether this is what we call white coat hypertension or just in the office, or if it's really hypertension. So they wear a blood pressure monitor for 24 hours, including sleeping. That's so important because if there is a loss of fluctuations in the blood pressure and it doesn't come down when it should, and it doesn't go up when it should, that can be a problem. So that's one of the ways that we diagnose hypertension, to see if it stays below that 130/80. 48.1% of Americans, that is 119.9 million Americans, have hypertension. So it's a serious issue.
And I will say that certainly in my field with pregnancy, we do home blood pressure monitoring. So some people out there may have their monitors. They may not have that 24-hour monitor, but there are blood pressure cuffs that you can purchase or be assigned by insurance that you can monitor your blood pressures, because it is important to know, is it always this way, or is it just when you come to my office? Sometimes people have to come to my office, they have to ride 2 buses and they, were delayed and they're worried about being late. Their blood pressure might be a little higher than it usually is. So, or other things. I am terrified of doctors, or I quite frankly don't always like going to the doctor's office. So there are reasons why it might just be one isolated point, as you point out, to know what it is throughout the day, or to know more data points or more times of what it really is. That's what we want to treat, not that one blood pressure that you came in their office. Now tell me, I have people come to my office and they say, as you know, and most people know, I do pregnancies, and so high risk pregnancy. So they're referred to me like mid-pregnancy, perhaps. Their blood pressure is elevated. I asked them, did you have high blood pressure with your last pregnancy? And they said, well, yes, I did. Did you have high blood pressure between your pregnancies? And they said, no. And I said, did you go to a doctor or ever have it checked? And they say, no. Can you tell what your blood pressure is if you don't check it with a blood pressure monitor?
That is such a good question and so important, because oftentimes, no, is what we call the silent killer, because you may not have any symptoms at all. You may not have a headache or swollen ankles or heart racing or chest pain. It's often that you don't even know that you've had high blood pressure, and it can last for decades, sometimes before you even have realized that your blood pressure is high.
And when it gets to that point where you have chest pains or ankle swelling or other things, there's some problems going on. You don't want to wait till you see those symptoms. You want to treat it, as you say. That's why they said, let's change from 140 over 90. Let's come down lower. Let's start treating this sooner so we can prevent some of those complications. Can you talk a little bit about, why we treat it? What are the complications of high blood pressure?
Absolutely. So by the time that blood pressure has been elevated for a long period of time, now we start affecting the arteries and of the heart. So those heart arteries get roughened up, they get damaged, and quite frankly, they need to be taken care of and they need to be healed. So now the body goes to repair the arteries of the heart by increasing cholesterol. So it sees damage and tear. I tell people, come to love your endothelial lining. It's one cell thick, so it lines.
And the endothelial lining is the lining of the blood vessel, right? Yeah.
Yes.
Yeah.
And it's only one cell thick, and it lines every blood vessel of the body. So if that gets damaged, the body goes, uh-oh, we need to go fix that. So it sends cholesterol up to patch up and repair the lining. Well, then that cholesterol starts building up, and now we have an artery that is damaged and can clot. And now we have no blood flow or lack of blood flow, decreased blood flow to the heart. So now that heart starts to be affected and die off in certain points.
You can have a heart attack. It can build up the muscle, any muscle you use repeatedly all the time is going to tire out, or
Yes.
have a heart attack. Or same concept to your kidneys, to your eyes, to the vision can be affected. People can have ultimately blindness related to a kidney failure, dialysis, all those things that perhaps we can modify by just reducing the pressure that the heart has to use to push through the blood vessels because they've been damaged. But it's the damage from the high blood pressure that started. So it's like a cyclic thing. It just gets worse and worse and worse. And that's why we want to try and control it early.
Yes.
And the only way we can know that is that you monitor your blood pressure some way. So it's important. How often do you recommend people see a doctor, routinely? Like I deal with pregnancy, but outside of pregnancy, how often would you see a doctor just to say, check my blood pressure and some things that might be of concern?
So even if you have normal blood pressure, the recommendation is no longer that you just see a doctor once a year. We found that that is not enough because there are so many things that can happen within those 12 months. So every 6 months, even if you have normal blood pressure, and more often than that, as often as every 3 months, to monitor. Because if you are taking medication, we need to know, is it working? Is it reducing your blood pressure the way we want it to? Because we don't want to have the stroke or the chronic kidney disease or heart failure. So it's more often that we see people that will say, oh, I just need to see my doctor once a year. Well, guess what? Maybe the blood sugar is starting to increase, and it's not your hypertension, it's not your blood pressure, but it's other things that can contribute to that blood pressure being high.
And that can sort of float us into diabetes,
Yes.
and the concerns with blood sugar. And can you talk a little bit about diabetes?
Absolutely. So one of the main things you want to think about with diabetes is it starts off with insulin resistance. So insulin resistance can precede diabetes by 5 years. So if you imagine insulin and blood sugar. So you eat food, turns into glucose, goes over to the pancreas, grabs insulin. Now that insulin has to push that sugar into the cell. So it's the key that unlocks the cell to drive that glucose in. Well, if your cell still has a lot of glucose in it that you haven't used up, now you have resistance to that insulin letting that glucose into the cell.
And
Now
glucose is sugar, right? Glucose
Yes.
is a form of breakdown of sugar. So go ahead.
Is the breakdown of sugar. So now that sugar goes to the brain and goes, wait, what are you doing in the bloodstream? You need to get in the cell. So now you release even more insulin. The insulin and the sugar has spikes on it, if you were to put it under a microscope, and it's causing scrapes and tears along the blood vessel wall. So now you're right back to, we've damaged the blood vessel wall. Now we've got to repair the blood vessel wall. So we've got high insulin. Now we've got high blood sugar. So we call that diabetes. If you have a blood sugar over 126 consecutively, more than one reading, or what we call the hemoglobin A1C, and that's an accumulation of blood sugar over 120 days, and it assigns a number. That needs to be below 6.5. Because if those two factors, if you've got a blood sugar over 126, you've got an A1C over 6.5, now you have type 2 diabetes, which could have been prevented 5 years before.
And sometimes, similar to high blood pressure, there are symptoms that come with diabetes, but sometimes it's not until later. What are some of those symptoms that people, if they notice this, maybe ought to make sure they get checked for diabetes?
So if you start having excessive thirst, you drink water and it just does not quench your thirst, or you're urinating really frequently, you're having to run back and forth to the bathroom. So we call it polydipsia, a big long name, but too much water, too much urination, and too hungry. Like you cannot get full. You can't get satiated with what you eat. You just feel like you have to eat and eat and eat and eat. Those are some signs of type 2 diabetes.
And are there risk factors for both hypertension and diabetes that maybe some people are more at risk or certainly want to, everybody wants to make sure they're monitored on a regular basis, but maybe a little bit more because there's some risk factors?
Yes. So newer studies have also said, even if you have normal blood pressure, if you've had parents that have had diabetes, or if you've had parents that have had high blood pressure, you are at a higher risk, which is another reason to get checked more frequently, because you are at a higher risk just because of your heritage. African Americans are at much higher risk. It's usually 17 to 21% higher if you are African American. So you want to make sure that you know your family history. Is there diabetes in your family? Are there high blood pressure tendencies in your family? You want to make sure that you get this checked out first.
And we talked in some other podcasts about family history with cancers and breast cancer, other things, and the importance of just talking with your family about the family history. Unfortunately, sometimes that's not done for different reasons. You may be adopted and not know it, but certainly if in our families, we want to talk about the family history of hypertension and diabetes and cancer so that we can be more prepared. And when a doctor asks us, are there risk factors? And as we get more intelligent as physicians and care providers about screening tests we can offer, to be more deliberate about who we offer those to. I will also say, certainly in pregnancy and preterm labor and other complications, stress is a factor. And I think stress is a factor with hypertension and other complications that are more frequent, oftentimes in African Americans, people of color, because unfortunately in our lifestyles, we're under more stress. So certainly, race will be a factor. They always say race is a factor for increased risk for hypertension. Well, I often argue the point race is just a man-made construct. It's just a skin color. Why is it behind the race? And I think stress and some of those things go along with it. Maybe genetics as well. But certainly, I just want to stress that point and say we're all under stress. And if we're,
Yes.
as women, there's so many intersectional pieces to what we might go through. A woman of color, a woman with children, a woman with, elderly parents and other things, with a job, with other things, or men for the same factor. I deal with women, so I talk about women's issues. So I will throw that out to say, there are things we can do, which maybe you'll talk about a little bit as we get into factors that can help relieve stress and
Yes.
help, help reduce some things. So is there anything else you think we can talk about before we go into lifestyle changes and diet and exercise that we may have missed on talking about diabetes and hypertension that you want to make sure we cover?
I do want to definitely cover that stress factor because stress often leads to lack of sleep.
Mm.
So the reason why that is important, because we have what we call cortisol. So cortisol is secreted from what we call the adrenal glands, and they sit on top of the kidneys. And cortisol is that fight or flight hormone. We may think of it as adrenaline. You've got to run from the tiger. You've got to get out of the house because it's on fire. Adrenaline goes way high. So what should happen with that is it should be high in the morning, come down during the day, and now the stress is decreased. However, a lot of times if we're stressed throughout the day and we don't have methods or ways to decrease that stress, then we don't sleep at night. The reason why that's important is because that cortisol increases at night. And you know how people might say, well, I start getting this belly fat. Where did that come from? That's typically cortisol. Because the body, here's what can happen. As you don't sleep, the body releases that cortisol and you get your second wind. So people say, gosh, I can stay up until 1 o'clock in the morning because I get my second wind. Well, the body releases cortisol because it doesn't think you are going to go to sleep. It goes over to the liver, grabs sugar and goes, okay, let's go. Cortisol rises where you're not doing anything with that cortisol. So it just starts to gather because you're not expending that sugar. So it starts to collect in the middle and then insulin resistance. So as you decrease stress, that is decreasing cortisol. You get in that deep sleep, restful sleep. And, we'll talk about some of this later, but prayer, meditation, deep breathing, able to decrease that cortisol. And now, just by doing that, you can reduce your risk of hypertension and diabetes.
And I will tell you that certainly in my field with preterm labor and complications, why is it higher in people of color and the risk factors? And there's a thing called weathering. I don't know if you've heard of it, but that there's breaks in the chromosomes related to oxidative stresses or stresses that occur in life. And your body cannot recognize, am I bumping up my cortisol because the tiger just jumped through the wall, or am I bumping it up because that police officer just passed me and stopped me and asked me a bunch of questions, or I'm concerned that he might, or that somebody walked by me and said, how'd you get a job here? The microaggressions that sometimes people have to face, or even the overt racism that we deal with sometimes on a daily basis, are things that we tolerate and adjust to, but our bodies are constantly going through this same kind of insult as if our house is on fire and we've got to get out, even though we may manage it well and we look good while we're doing it, but our bodies are going through all those things. So some things that can help us deal with that and efforts to help reduce that in our society certainly are all things that can be factors. And that's why I personally believe, the risk of hypertension and diabetes and other complications are not just race related, it's racism related. And we will certainly, hopefully, find avenues and people to advocate for all people to reduce those stresses. But today, hopefully, we'll talk about some things we can do individually to reduce the stress in us so that we can be better equipped for life in those challenges. So I'll look forward to getting into that conversation. I wanted to roll back just a minute and talk about just some other concerns related with diabetes, related to that poor blood flow through those vessels that have been damaged from the shearing stresses on the endothelial or the lining of the blood vessel walls. That may lead to heart damage, nerve damage, and vision changes. Certainly, we have problems with eye and vision and things that can go on with diabetes. We have, I remember distinctly one lovely woman, elderly woman who my pastor actually introduced me to at church and said, he always likes to call me doctor. This is Dr. Lauren. And she says, she looks up to me, she's sitting in a wheelchair and she's got a knee amputation from the knee down. And she has, and she says, oh, honey, have they found anything to cure diabetes yet? And I looked at her and I said, no, ma'am, they haven't, because I just didn't have the heart to say, there's some things we can do to help prevent it. And that's why we're here today. And that's what I agree with you. I have a passion to help treat people there. That day, to her, there was no need for me to say, well, maybe if we change our diets and do some things early on. But that's why we're here today, because I tell patients who have gestational diabetes, which is diabetes during pregnancy, they have an 80% chance of developing diabetes later in life. And I said, you need to make sure you see a doctor or a care provider on a regular basis, because we can prevent feet getting chopped off and knees getting amputated. There's diet and exercise that can help that. But even if we need to go to medicine, we need to control that blood sugar so we can prevent those things. So I don't know if you have anything more you want to say about that, or then we can roll into talking about those things, diet and exercise and things that can prevent that.
Yes. So as I said before, I am so passionate about educating people to say it doesn't have to be this way. For one, there's something that's really simple. If we're going to start with stress, then we're going to talk about maybe some diet changes, exercise, but it's called belly breathing or alternating nasal breathing. So that helps to decrease. So the sympathetic, think of sympathetic as stress, and then the parasympathetic, P for peaceful. The sympathetic nervous system goes up, but we want the parasympathetic nervous system, that peaceful nervous system, to go up. So alternating nasal breathing is one way that we can do that. So you hold one side of your nostril, you breathe in, you hold for 6 seconds, and then the other side of the nostril, you breathe out. Now, what that does is it increases the parasympathetic nervous system and decreases that stress symptom. So just by breathing, and if you are in that stressful situation, there's those pressures and those stressors, and it is not easy for us to, as African Americans, to go through life and know that, you know what, there are some biases out there. As soon as you walk into an area, and it only takes a look. We don't have to do anything. We don't have to open our mouths. We don't have to say anything. It's just the way we appear. And all of a sudden, there's that bias there. So when you walk into those situations, and you don't even have to hold one nostril, you can do breathing, but just breathe.
Amen.
Decrease that stress that is there. And it's not seen. And I think that's one of the things that has happened in our society these days. It used to be more noticeable, right? It was seen. There were signs up as no Blacks in this area. And it was very obvious. But now it's not as obvious. But it doesn't mean it's not there. So when those situations come up, it's there. Breathe. Decrease some of that tension. And now, one of the things that we do in our office is we have an exercise room and we have a kitchen. So later on today, I'm going to be teaching a cooking class and how to make food that does not increase blood pressure and blood sugar.
Thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.